Can taking a simple vitamin supplement lead to kidney failure? Unfortunately, the answer is yes. And today we're going to dive into the shocking story of a 41-year-old mother who did just that. After taking what she thought was a harmless supplement, she ended up in the hospital with her kidneys barely functioning. What happened to her, and how can you avoid the same fate? Let's find out. 1. The start of a health nightmare. It all began with what seemed like a minor issue, a common cold. This 41-year-old mother, let's call her Lisa for the sake of this story, was dealing with the usual symptoms: a sore throat, runny nose, and fatigue. Like many of us, Lisa didn't have the luxury of time to be sick. She had a family to take care of, a job that demanded her attention, and the hustle and bustle of daily life that wouldn't pause just because she felt under the weather. In an effort to boost her immune system and expedite her recovery, Lisa turned to something she thought was safe: vitamin C. She'd read online and heard from friends that vitamin C could help reduce the severity and duration of colds. It was widely available, inexpensive, and generally considered safe by the public. So she started taking it regularly. Initially, she followed the recommended dosage, about 500 milligrams per day, a common amount that many people take daily as a supplement. However, when her symptoms persisted, Lisa grew frustrated. She was worried about missing work and being unable to fulfill her responsibilities at home. She thought, if a little bit of vitamin C is good, then more must be better, right? With this mindset, she decided to increase her dosage significantly, doubling, then tripling, and eventually taking up to 5,000 milligrams per day. For context, the recommended daily allowance for vitamin C is about 75 milligrams for women and 90 milligrams for men, with an upper limit of 2,000 milligrams per day. Lisa was taking more than double the maximum recommended dose, and she was doing it consistently over several weeks. What she didn't know was that this seemingly harmless decision would soon lead to life-threatening complications. After about 2 weeks of her high-dose vitamin C regimen, Lisa started experiencing some alarming symptoms. She noticed severe abdominal pain, which she initially dismissed as indigestion or a stomach bug. However, the pain didn't subside. Instead, it intensified. She also began to experience headaches, confusion, and difficulty breathing, symptoms that were far more serious and couldn't be ignored. Her daughter, who was growing increasingly concerned, urged her to see a doctor. By the time they arrived at the emergency department at the University Medical Center, Lisa was in bad shape. She was confused, disoriented, and in significant pain. Her breathing was labored, and she had been vomiting repeatedly. The medical team immediately recognized that something was seriously wrong. They ran a series of tests, including blood work, to determine the cause of her symptoms. What they found was shocking. Lisa's creatinine levels were through the roof, 10.1 milligrams per deciliter. To put that in perspective, normal creatinine levels in women are typically between 0.6 and 1.2 milligrams per deciliter. Her levels were nearly 10 times higher than they should have been, indicating that her kidneys were barely functioning. This was a clear sign of acute kidney failure. 2. The hidden danger of over-the-counter supplements. Lisa's case left the doctors puzzled at first. She was a relatively healthy woman with no significant medical history that could explain such a sudden and severe kidney failure. She wasn't taking any prescription medications, and there was no recent travel or exposure to toxins that might have triggered her condition. It wasn't until they dug deeper into her recent health history that the pieces of the puzzle began to come together. When asked about any supplements or over-the-counter medications she had been taking, Lisa's daughter mentioned the vitamin C. At first glance, it didn't seem like a likely culprit. After all, vitamin C is known to be water-soluble, meaning that any excess is typically flushed out of the body through urine. However, in Lisa's case, her excessive intake had led to a dangerous buildup of oxalate, a compound that can cause serious damage to the kidneys. Oxalate is a naturally occurring substance found in many foods, and it's usually harmless when consumed in normal amounts. However, when taken in large doses, vitamin C can convert into oxalate in the body. This oxalate can then bind with calcium in the kidneys, forming crystals that can cause blockages and lead to the development of kidney stones. In severe cases, like Lisa's, these oxalate crystals can cause acute tubular necrosis, a condition where the tiny tubules in the kidneys are destroyed, resulting in kidney failure. The rise in the use of supplements like vitamin C has led to an increase in cases of kidney damage related to their misuse. Vitamins and supplements are marketed as safe, natural ways to improve health, but the potential dangers are often overlooked. Many people assume that because these products are available over the counter and don't require a prescription, they must be harmless. However, as Lisa's case shows, even something as seemingly benign as vitamin C can become toxic when taken in excessive amounts. The growing popularity of supplements is also driven by the widespread belief that more is better. People are constantly bombarded with messages about the health benefits of various vitamins and minerals, leading some to take them in higher doses than recommended. However, these products are not without risks, especially when taken in large quantities without medical supervision. While vitamin C is generally considered beneficial in appropriate doses, taking too much can have serious, even life-threatening consequences. 3. The medical response. Once the medical team realized that Lisa's kidney failure was due to her excessive intake of vitamin C, they knew they had to act quickly to save her life. The first step was to start emergency dialysis, a procedure that would help remove the buildup of waste products and excess fluids from her blood, tasks that her kidneys could no longer perform. Dialysis is a life-saving intervention for patients with kidney failure, but it's not a cure. It's a way to manage the symptoms and keep the patient stable while doctors work to address the underlying cause of the kidney failure. In Lisa's case, the dialysis sessions were critical in preventing the buildup of toxins in her body, which could have led to severe complications, including death. The dialysis sessions were grueling. Each session lasted several hours, during which Lisa was connected to a machine that filtered her blood, removing the waste products her kidneys could no longer handle. The process left her feeling weak and exhausted, but it was necessary to keep her alive. Over the course of 2 weeks, Lisa underwent multiple dialysis sessions as the medical team worked to stabilize her condition. During this time, the doctors also conducted a series of tests to assess the extent of the damage to Lisa's kidneys. They performed a renal biopsy, which involved taking a small sample of kidney tissue to examine under a microscope. The biopsy results confirmed the presence of massive oxalate crystals in her kidneys, as well as acute tubular necrosis. These findings provided the final piece of the puzzle, confirming that Lisa's kidney failure was directly related to her high-dose vitamin C intake. With the cause of her kidney failure identified, the medical team focused on managing her condition and preventing further damage. In addition to the dialysis, they adjusted her diet to reduce her oxalate intake and advised her to avoid any further supplementation with vitamin C or other potentially harmful substances. They also provided her with information about how to manage her condition moving forward, including the importance of regular follow-up care to monitor her kidney function. The good news was that Lisa's kidneys did start to show signs of recovery. Her creatinine levels gradually decreased, indicating that her kidneys were beginning to function again, albeit not at full capacity. By day 14, her creatinine level had dropped to 2.2 milligrams per deciliter, a significant improvement, though still higher than normal. This was a positive sign that the dialysis and other interventions were working, but it also meant that Lisa would need to be closely monitored to ensure her kidneys continued to improve. 4. The science behind vitamin C and its risks. Vitamin C, also known as ascorbic acid, is an essential nutrient that plays a crucial role in maintaining overall health. It is widely recognized for its powerful antioxidant properties, which help protect the body's cells from damage caused by free radicals, unstable molecules that can contribute to the development of chronic diseases, including cancer and heart disease. Vitamin C is also vital for the synthesis of collagen, a protein necessary for the maintenance of healthy skin, blood vessels, bones, and connective tissues. Moreover, vitamin C enhances the absorption of iron from plant-based foods and supports the immune system, making it a popular supplement, especially during cold and flu season. Given its numerous benefits, it's no surprise that vitamin C is one of the most commonly consumed supplements globally. Many people take vitamin C to boost their immune systems, prevent colds, and improve skin health. In most cases, vitamin C is safe when taken within the recommended dietary guidelines. The recommended daily allowance, RDA, for vitamin C is 75 milligrams per day for women and 90 milligrams per day for men. For those who smoke or are exposed to secondhand smoke, the RDA is slightly higher due to the increased oxidative stress and damage to the lungs caused by smoking. Vitamin C is a water-soluble vitamin, meaning that the body does not store it. Instead, it dissolves in water, and any excess amounts are typically excreted in the urine. This property has led to the widespread belief that taking large doses of vitamin C is harmless, since the body can simply get rid of the excess. However, this assumption overlooks the fact that consuming extremely high doses of vitamin C can lead to the formation of oxalate, a compound that can have serious health consequences, particularly for the kidneys. When vitamin C is ingested in excessive amounts, the body metabolizes the surplus into oxalate, which can then bind with calcium in the kidneys to form calcium oxalate crystals. These crystals are the main component of kidney stones, small, hard deposits that can cause significant pain as they pass through the urinary tract. While kidney stones are often small enough to pass on their own, they can sometimes cause blockages that require medical intervention. In Lisa's case, her excessive intake of vitamin C led to a dangerous buildup of oxalate in her kidneys. Over time, the oxalate crystals accumulated, causing acute tubular necrosis, a condition in which the tiny tubules in the kidneys are damaged, leading to a rapid decline in kidney function. This condition resulted in acute kidney failure, which required emergency dialysis to prevent toxins from building up in her blood and causing further complications. The risk of oxalate buildup is particularly high for individuals who consume more than 2,000 milligrams of vitamin C per day, the upper limit set by health authorities. However, even smaller doses can pose risks for people with pre-existing kidney conditions or a history of kidney stones. For these individuals, the safe intake of vitamin C is significantly lower, and any supplementation should be done under the guidance of a healthcare provider. Furthermore, while vitamin C is widely regarded as safe and beneficial, the potential for toxicity exists when it is taken in excessive amounts over an extended period. High doses of vitamin C can lead to other side effects as well, including gastrointestinal issues such as diarrhea, nausea, and abdominal cramps. In extreme cases, as evidenced by Lisa's story, the consequences can be much more severe, leading to life-threatening conditions like kidney failure. It's also worth noting that the body's ability to absorb vitamin C decreases as the dosage increases. For example, at doses of around 30 to 180 milligrams per day, about 70 to 90% of vitamin C is absorbed. However, at doses above 1,000 milligrams per day, absorption drops to less than 50%, and the rest is excreted. This means that taking megadoses of vitamin C may not provide additional benefits and can instead increase the risk of harmful side effects. 5. Life after kidney failure. Lisa's ordeal didn't end when she was discharged from the hospital. While her kidney function had improved enough to allow her to go home, she still faced a long road to recovery. Her doctors warned her that her kidneys might never fully recover and that she would need to be vigilant about her health moving forward. One of the first things Lisa had to do was make significant changes to her diet. Her doctors advised her to follow a low oxalate diet, which involved avoiding foods that are high in oxalate, such as spinach, beets, nuts, and chocolate. She also had to increase her water intake to help flush out any remaining oxalate from her system and reduce the risk of further kidney damage. In addition to dietary changes, Lisa was placed on a strict medication regimen to support her kidney function and prevent complications. She was prescribed medications to manage her blood pressure, which had been elevated due to her kidney failure, as well as medications to help prevent the formation of new kidney stones. Regular follow-up appointments with her nephrologist were also scheduled to monitor her kidney function and ensure that her condition didn't worsen. The emotional toll of her experience was also significant. Lisa had gone from being a healthy, active woman to someone who had to think about her kidneys every day. The fear of her kidneys failing again was always in the back of her mind, and she struggled with the anxiety that came with this new reality. She also had to explain her situation to her family and friends, many of whom were shocked that something as simple as vitamin C could cause such severe health problems. Despite the challenges, Lisa was determined to regain her health and get back to her normal life. She followed her doctor's advice to the letter, sticking to her new diet, taking her medications as prescribed, and attending all her follow-up appointments. Over time, her kidney function continued to improve, and her creatinine levels gradually returned to near normal levels. While Lisa's kidneys were never fully restored to their pre-failure state, she was able to avoid further dialysis and managed to live a relatively normal life. Her experience served as a powerful lesson, not just for her, but for everyone around her. She became an advocate for safe supplementation and often shared her story with others to raise awareness about the potential dangers of over-the-counter vitamins and supplements. 6. The importance of safe supplementation. Lisa's story is a stark reminder of the potential dangers of vitamin misuse. While vitamins are essential for good health, they must be taken within the recommended guidelines to avoid adverse effects. Her case highlights the need for greater awareness about the risks associated with high-dose vitamin supplementation, especially when it comes to over-the-counter products that are easily accessible and widely promoted. One of the key lessons from Lisa's experience is the importance of consulting a healthcare provider before starting any new supplement regimen. What works for one person might not be safe for another, particularly if there are underlying health conditions involved. Doctors and nutritionists can provide personalized advice that takes into account an individual's health history, current medications, and overall nutritional needs. Another important takeaway is the need for better regulation and labeling of supplements. Many people are unaware of the potential risks associated with high-dose vitamins because the information isn't always clearly communicated. There's a growing call for more stringent guidelines on how supplements are marketed and labeled, particularly in terms of dosage recommendations and potential side effects. It's also crucial to understand that more is not always better when it comes to vitamins. The recommended daily allowances are set for a reason, and exceeding these limits can have serious health consequences. This is especially true for fat-soluble vitamins like vitamin A, D, E, and K, which can accumulate in the body and cause toxicity if taken in large amounts. But as Lisa's story shows, even water-soluble vitamins like vitamin C can be dangerous when taken in excessive doses. There is a widespread belief that vitamins are harmless and that taking them in large amounts can only be beneficial. However, this is a misconception that can lead to serious health problems. By raising awareness about the potential risks and promoting safe supplementation practices, we can help prevent others from experiencing the same fate as Lisa. If you found this story eye-opening, make sure to like this video and subscribe to our channel for more real-life health stories and tips. Remember, when it comes to your health, always consult a professional before starting any new supplement. What do you think about Lisa's story? Do you know anyone who takes high doses of vitamins without realizing the risks? Let us know in the comments below, and let's keep the conversation going. Stay safe, and see you in the next video.